Top story now, and that's the cruise ship in Sydney. It's carrying over 100 COVID positive people. It's arrived at Sydney Harbour this morning. Joining us live from Sydney International Airport is the New South Wales Deputy Premier Toole. Deputy Premier, good morning to you. We are here to talk about foot and mouth, but I just want to get the latest information from the government on this ship. What reports have you received from the Coral Princess this morning since it docked?
Yeah, look, thanks, Pete, and good morning. Obviously, the latest information I've received this morning is that New South Wales Health is continuing to work with those passengers and those crew members on the Coral Princess, and they'll continue to ensure that anyone that leaves the ship has actually tested negative. There are a number of our crew members that are going to possibly leave today, but mostly at the moment, New South Wales Health are continuing to work with crew and passengers to ensure that we actually contain that spread. We obviously did see a number of COVID cases that have actually come out on the Coral Princess, and obviously they've acquired the COVID virus after they'd boarded the ship.
Yeah, so what if someone's COVID positive, though, and wants to get off in Sydney and finish the journey?
Well, they might want to get off, but my understanding at the moment is that New South Wales Health is not letting anyone off unless they've actually tested negative. So they'll be remaining in the care of New South Wales Health, and they'll be undergoing testing before that is able to occur. And I think that's important because, as a community, we've worked very hard over the past couple of years to ensure that we've done the right thing. I know that the crew have been vaccinated on the Coral Princess, but we still want to make sure that there are no threats back here to the people of New South Wales. Right.
I mean, there'd be people flying at the moment who are COVID positive, though, and are just simply going through airports and going home. Is the cruise ship industry coming in for a bit of unfair stick here?
Well, I think it's about looking at the risk here, and obviously, cruise ships are very different as well. You are in an enclosed environment for a long period of time, and in some cases, you are on those cruise ships for a number of days. So, it does look at the risk. It does look at where people have been on those cruise ships in relation to how many days those trips take place. Whereas people are flying in and out. They're not necessarily sitting on a plane for several days at a time.
Yeah, but we're told that this new variant of COVID, it moves pretty quickly anyway, so it doesn't really matter how much or how long you're in an enclosed space.
Well, I think it's a reminder to every one of us that, COVID is still around, and we're going to continue to see new variants coming up from time to time. But we've also got to make sure that, we live with the virus, and we've got to make sure that we remind people, to go out there and get their boosters, and those that are eligible to go and get their fourth shot as well. It is very concerning that, a number of people have already got their first 2 shots, but a lot of people still haven't received their 3rd booster. So we really want to remind people, especially coming into the winter period, when both the flu and the COVID virus are, more easily spread, can we go and ensure that they do get their virus and their booster shot as well?
OK, you're at the airport this morning. Foot and mouth is a concern. Primary industry is very concerned about this at the moment because it's getting closer and closer to northern Australia. How secure is our border when it comes to foot and mouth right now?
Well, look, I've been speaking with the Federal Agricultural Minister, and I know that he understands the seriousness of this threat. But we also want to make sure that nothing is left unturned. We've got to make sure that we're throwing everything at this right now. And I am out here at the Sydney airport this morning, and I'm actually putting a plea out to travellers that we have a real biosecurity risk on our doorstep. Now, with foot and mouth disease, it is the closest it's ever been to the shores of Australia. And we've got to make sure that we keep Australia safe. We've got to make sure that we keep our livestock safe, because we don't want it getting into the country. I mean, if it gets into Australia, this could actually have an $80 billion impact on the livestock industry here in Australia. So we've got to make sure that we're doing everything to ensure that it is not getting into this area. Now, we know that at the moment, it's the closest it's been here in Bali and also parts of Indonesia. There's a lot of people at the moment that are travelling over to Bali and returning. And I've got a very simple message that you need to make sure that you stay away from farms, you stay away from livestock, you actually ensure that your shoes are cleaned. Because at the end of the day, you don't want to be the person bringing that virus and that disease back into our country.
Well, David Littleproud says there should have been foot baths at airports last week. Should that have been the case? Should that have been in place?
Well, I've actually, written to the Agricultural Minister, and I actually think we actually need to leave nothing unturned. And this means that, 100% of those that are returning back from Bali should actually have all of their luggage screened. I mean, they should ensure that, all shoes and clothes are decontaminated. I've asked for the federal government to actually provide more detector dogs out here at the airport. And I've also asked them to actually start right now a targeted advertising campaign, because we have too much to lose. There is too much at risk at the moment to actually sit back and be complacent about this.
Right.
We can't afford to see FMD getting into this country.
Sure. How much of this is your responsibility, is a state responsibility, though?
Well, I think look, obviously in New South Wales, we're actually got biosecurity measures in place, but the idea is to stop it getting into the country. And I know that is, with the federal government. I want to work with the federal government. I want to make sure that we give them suggestions to be able to deal with it, and we'll assist them if we can. But at the end of the day, we've got to stop it from getting into our country, and the best place to do this is at the airport.
OK, Paul Toole, we're out of time, but appreciate your time this morning. Thank you. We'll talk to you soon.